The shockwaves reverberate. Health and Human Services Secretary Robert Kennedy Jr. wants to trim 20,000 employees, or about 1 in 4 employees. For analysis of what this might mean for agency operations, Federal Drive host Tom Temin spoke to a long-serving HHS executive, now in private consulting, Jeff Grant.
You were at the Centers for Medicare and Medicaid Services specifically. Tell us what you did there and how many employees it had relative to the tasks it was trying to do at that time.
So I worked at CMS in the role of managing healthcare.gov and a few other major operations we had around the No Surprises Act, around making payments and things like that. My staff was 600 approximately total, and on CMS overall was about 6,700 people.
And overall, CMS is Medicare and Medicaid, ultimately, the really big kahunas, you might say, of more than $1 trillion a year. I think the figure's about $1.5 trillion go out of there. And so I imagine it takes a certain amount of people to make sure that the money is spent properly. Is that basically what they do?
Oh, yes, it's absolutely true. And, the population of consumers in the ACA markets and beneficiaries under Medicare and Medicaid has also grown. So we're taking care of money and we're taking care of people. So, you have over 150 million people under our care. So that was a huge responsibility that CMS bears.
In that sense, CMS had twice the number of people that are under Social Security.
Correct, because of Medicaid and the marketplaces.
Okay, well, I'm about to be both, so we'll see how they're doing. But how do you think these cuts will affect things?
What I think people need to know to contextualize all this is that CMS had already shrunk in size because we've had flatline budgets since 2013. So when you think about what has happened even recently in inflation, the rise in wages, the rise in healthcare costs, a flat budget from 2013 to 2025 means you really are having to downsize to work within your budget. So we at one point at CMS, when I was working on Part D, had about 7,500 people. Since then, they've passed the Affordable Care Act. They've passed the No Surprises Act. They passed the Inflation Reduction Act that brought drug price negotiation as a new line of business for CMS. We're doing all these things with fewer people than we had before we had all of these responsibilities. That was what CMS was facing. These cuts are crippling to an agency that was already vastly understaffed.
Right. So that means then that if Robert F. Kennedy wants to cut another 10,000 besides the 10,000 that took the fork in the road, that's kind of the cherry on top of neglect that has spanned both parties and several Congresses.
That is correct. I think what you will see is just, you mentioned the 1.5 trillion. I think that's the most important point, is that we are mucking about in CMS in a couple $2 billion that is controlling the spending of 1.5 trillion. If you want to actually look at long-term sustainability of these programs, you need to actually staff CMS up to not just run the same programs they run every year, but to hire people that can deliver dynamic change that will actually reduce that 1.5 trillion. That is what the focus should be, not on playing around in the extreme margins.
And just as an aside, you also need some policy direction from Congress for the long-term spending curve if you really want to think about deficit reduction and all that kind of stuff.
Oh, absolutely. I think there are some things that CMS itself could do. And if they say that there is fraud, which they are alleging they're finding fraud, well, the way you get rid of it is with federal employees and contractors working on the alleged fraud that you have found. So if there are billions and billions in fraud, you're spending $2 billion on a workforce, deploy that workforce to get after the fraud.
We're speaking with Jeff Grant. He's a former Health and Human Services senior executive, specifically at CMS. He's now a health care policy consultant. And you must be watching the rest of HHS just as an observer and an expert in healthcare policy, because this is coming to FDA, to the NIH, to, I guess, the Centers for Disease Control and Prevention, and they all have operational function to simply get statutory requirements done.
That is correct. And I have a number of people because of I've taken an active role in trying to get people placed in new jobs as they're getting let go. So I'm hearing from people from NIH, FDA, CDC, and I'm looking at their resumes, their LinkedIn profiles, and you see the level of expertise that you are losing. I mean, it's not just that these people have jobs. These are really smart people, and with this round of reduction in force, they're taking out whole divisions, which means you're getting rid of senior and junior people. And really, and the fork in the road, I think, did the same thing. The return to workplace is doing the same thing. Voluntary early retirement is going to be only very senior people, very experienced people, people that really know what they're doing and really move things forward for the American people, both policy and operationally, doing research that we need on diseases, on drugs. These are really, really talented people. They're very hard to replace, and it's very hard to get somebody if you go and reduce by 25%. When you need to build this back up, which you're going to need to do, it's going to be hard to have people have faith that they should take a federal job.
And traditionally, if an individual was fed up with their federal situation, there was always a job, more or less, in the contractor community because the contractors outnumber the federal employees. In this round of what's happening now, that doesn't seem to be the case because contracts are being cut along with federal employment. Is that what you're seeing in the healthcare area?
Absolutely. And I'm working to try to place CMS people. And I have, with 30 years at CMS, I have tremendous deep ties in the contractor community, and people that normally would have scooped these people up are all sitting pat right now because nobody wants to hire until they figure out where their contracts are headed. They don't want to hire people and lay them off a couple of months later. So the contractor community, I think, is as fearful of having to cut staff and create a greater glut of healthcare expertise on the market. I think this is going to be a really tough job market for everybody in this field.
Right. Even in normal times, contractors could probably confidently take on people, but when they're uncertain, corporate uncertainty means you don't take on payroll.
Correct. And they are talking about hiring now our former employees potentially as subcontractors, which is no commitment to a long-term relationship. It's like, we can get you some money for now, figure out what you're doing for your health care. And, I can't tell you how long you're going to work for me. You're a contractor.
And those in the public, the citizens that might need to contact, say, a CMS, because I think people don't realize until they go for it how complex Medicare really is. And it is a Byzantine system along with the tax system. And what's your expectation for phone service or mail service, customer experience service from these agencies to these millions of Americans that have questions?
So I think there's a couple of things. If you are looking at a demand to cut contracts the same way that you cut staff, one of the first places you can do it is at call centers. So you reduce call center staff and you increase wait times. They have already, for reaching federal employees, the way it works is you normally call a call center, and if there is a case that requires an intervention by a federal employee to solve your problem, it would be passed over to caseworkers that are federal employees. Yesterday's cuts are going to hit the caseworker community hard, which will hurt people that are in Medicare Advantage, in the prescription drug benefit, and in the ACA market. So we're talking about 60 million people. If they need cases resolved, it will take longer. Plus, that same group of people, another set of them, handles overseeing these health plans that now do the benefit on behalf of the federal government. But they help them with compliance. They oversee them when they're non-compliant, but they also provide just a lot of technical assistance to health plans to understand how to properly serve Medicare beneficiaries. And you're cutting back that workforce as well, which means non-compliant plans won't get the same kind of follow-up that they have. Compliance problems will be missed or unaddressed. So this will all degrade the kind of service that Medicare beneficiaries and Affordable Care Act consumers are used to receiving.
And fair or accurate to say that those in the ACA, in the markets, are the people with fewer personal resources, perhaps, than people in Medicare Advantage?
That is true. Though
So
I will
the
point out, Medicare beneficiaries are also on limited, they're fixed incomes, they're retired. So there's a lot of those that also have fairly limited resources.